Colleagues, I rise to support Senate Bill 906. We're asking for your support of this bill. Severely intellectually disabled individuals and their families deserve to have a state center safety net. The intellectually disabled deserve a choice on the type of care and housing that they are afforded. Some families may choose a state center that stands the test of time, has solid, dependable staff who are trained professionals who will still exist. These state centers will still exist even after mom, dad, and siblings have passed away. Many families find community care, a private industry, to be inappropriate for their family member. While some private community companies flourish, some private community companies interact with the community and have dependable staff, there are others that are not so dependable. 11,000 staff around the state do not report for their shift. This leaves the disabled uncared for and in an unstable and unpredictable environment. These private companies can go bankrupt. They can take money from the state and then not pay their property taxes. They are desperate for qualified staff, and they pay low wages. Many staff are not appropriately trained, and they cannot handle the demands of their job duties. This is a crisis here in Pennsylvania, and the intellectually disabled community is a growing community. The numbers and costs have been artificially inflated. The current centers are not allowed at this time to have admissions. They're rarely allowed admissions. This drives up the cost. Empty buildings at state centers are rehabilitated to the tune of hundreds of thousands of dollars. Empty buildings rehabilitated, and that drives up the cost. Department of Human Services has disallowed the hiring of certified nursing assistants, and instead registered nurses have to work overtime at increased wages. This drives up the cost. These are all ways that the cost has been artificially driven up. So colleagues, case law guarantees that the intellectually disabled are offered and afforded choice between community care and care at a state center. Currently, a family with 2 disabled siblings cannot even get the 2 disabled siblings to be together at a state center. They can sue, families have sued until they've gone bankrupt, and they can still not place a family member in a state center, that they have the choice and that they feel that that is appropriate care. Our colleague from the Southeast spoke about fiascos, and there are fiascos in care, terrible fiascos that have happened where individuals are disabled, terrible things have happened, and you still cannot get that choice to have state care. So we're asking you, please vote for Senate Bill 906. Please give us a chance to preserve choice. We have individuals who will have transfer trauma. When Hamburg Center was closed, there was transfer trauma for those individuals when they were forced to leave their home of over 40 and 50 years, and they did die. There were individuals that died earlier deaths, even though they may have been elderly, they died earlier deaths due to transfer trauma. So please, colleagues, this is a bipartisan effort. This is going to create a task force. There's so much more that we're going to be able to do together. Please vote for Senate Bill 906 and send it back to the Senate and to the governor's desk. Thank you so much.